How does HR plus status impact invasive lobular carcinoma, ILC? Imagine a type of breast cancer that tends to grow more slowly and responds well to hormone treatments. That's often the case with invasive lobular carcinoma that is hormone receptor positive or HR positive. About 90% of ILC cases have this HR positive status, meaning the cancer cells have receptors for estrogen and sometimes progesterone. This biological feature influences how the cancer behaves, how it responds to treatment, and what the outlook might be. Invasive lobular carcinoma is known for its unique biology. It usually has strong estrogen receptor positivity and tends to be low-grade, which means the cells look less abnormal and tend to grow more slowly. This slow growth often translates into a better initial prognosis compared to cancers that lack hormone receptors. The cancer cells also tend to have low proliferation rates, which means they divide less frequently. A distinctive feature of ILC is the loss of a protein called E-cadherin, which helps cells stick together. While this loss is a hallmark of ILC, it doesn't change the fact that HR-positive status generally indicates a more favorable outlook early on. When it comes to survival, women diagnosed with HR-positive ILC often have very high 5-year survival rates, especially if the cancer is caught early and is localized. The risk of recurrence during the first 5 to 10 years is relatively low, making the early years more manageable. However, unlike some other breast cancers, HR-positive ILC has a notable tendency for late recurrence. This means the cancer can come back even more than 10 years after initial treatment. Because of this, long-term follow-up is essential, and extended hormone therapy is often recommended to reduce the risk of late recurrence. The pattern of recurrence in HR-positive ILC is quite distinctive. The risk is lower initially but gradually increases over time, remaining a concern for many years. This contrasts with hormone receptor-negative cancers, which tend to recur earlier but less frequently after 5 years. This long-term risk underscores the importance of ongoing monitoring and possibly extended hormone therapy to keep the cancer at bay. Treatment strategies for HR-positive ILC are heavily influenced by the presence of hormone receptors. These tumors usually respond well to hormone therapies such as tamoxifen or aromatase inhibitors, which block the hormones that fuel tumor growth. However, ILC may not respond as strongly to chemotherapy as other types of breast cancer, and some tumors may develop resistance to hormone treatments over time. This means that personalized treatment plans are crucial, often combining hormone therapy with other approaches based on the patient's age, tumor size, and overall health. In clinical practice, the HR-positive status guides doctors to prioritize hormone therapy as a key part of treatment. Because of the unique biology and recurrence pattern of ILC, clinicians often recommend longer durations of hormone therapy, sometimes extending beyond 5 years. Younger women with HR-positive ILC might also receive chemotherapy in addition to hormone therapy to improve their chances of long-term remission. Overall, understanding the hormone receptor status helps tailor treatments that are most effective for each individual, aiming for the best possible outcome. In summary, HR-positive status in invasive lobular carcinoma generally indicates a better early prognosis and a strong response to hormone-based treatments. However, it also brings a long-term risk of recurrence that requires careful management and extended follow-up. Recognizing this helps healthcare providers develop personalized plans that optimize treatment and support long-term health. Always consult with a healthcare professional to understand the best approach for each individual case, as breast cancer's behavior can vary widely from person to person.